Dispatch for a patient that's got a headache and feeling weak. We arrive on scene. One patient's seen safe. Patient's sitting up and obviously coherent as we walk in. I say, "Hi, my name is Matthew, I'm paramedic. What seems to be going on today?"
My head hurts.
Okay. Is it okay if I sit down for a moment? Yeah, great.
Okay.
I do not have any troubles with your breathing, right?
No, breathing's good.
Do you mind if I feel your pulse?
Sure.
I'm just going to ask my partner to get a full set of IVs and get a cardiogram going. They're just going to put some stickers on your checks and take your vital signs. So what's going on? You got this headache, and when did this all start?
I got a headache, and I feel kind of weak. And
Okay.
woozy. It started maybe half an hour ago.
Okay. And how did it come on? Was it just sudden?
It was
just
pretty sudden. Yeah. I was doing the dishes, and I felt kind of off. So I sat down, and I just feel weak, and my head hurts.
Okay. Any other symptoms, or you find it hard to walk, or anything
like that? I feel like my like I'm just off.
Just off.
Yeah.
Okay, I'm not sure how. Do you know of anything that might have caused this to happen to you today? And you weren't doing anything?
It was kind of sudden. Yeah.
It was kind of sudden. Have you done anything to try to make it better?
I just sat down thinking that would help, but I still feel weak and off.
Okay. Have you ever had anything like this in the past?
No.
No, never felt like this. Okay. And we've done provokes and palliates. And quality, you're having a headache. Is it sharp or dull? Or
it's like a dull, just kind of all over.
Dull all over. Any changes in your vision or anything? Or I'm not sure.
No, not really. No, my vision's really okay.
As far as a headache, 10 being the worst you've ever had, 0 being
it's probably a 5 or
5.
4.
Okay.
Yeah.
4.5 out of 10.
Sure.
So it sounds like you were just around the house and you had this headache come on. Can you just remind me how long ago?
Maybe half an hour.
30 minutes. And you're just feeling off, like something's not quite right. Do you have any allergies?
No allergies. No.
Any medications?
Yeah, I take metformin, glyburide, and metoprolol.
What are you on those for?
The metformin and glyburide are my diabetes.
Okay.
And the metoprolol is for high blood pressure.
Okay. And do you take your medications as they're prescribed?
Yeah, absolutely.
Any recently discontinued or new medications?
No.
Okay. And any recreational drug use?
Nope.
Okay. Have you any diagnosed neurological problems?
No.
Nothing to ever have a stroke or a mini stroke?
No.
No history of any seizures?
Nope.
And no degenerative disorders, ALS,
No.
Parkinson's, anything like that?
Nope.
Are you prone to headaches? Do you get
No,
headaches or
not
tension
very often.
headaches or
Not
migraines?
often. No, I've never had a migraine before.
No. And no history of any infections or cancer in your brain or anything like that?
No.
Recently, haven't been noticing any changes that you've been noticing, like feeling like you don't have good coordination, or
not recently. No,
Just
not
today.
Today. Yeah.
Just today. Okay, no alterations in sensory or feeling things. No, feet or arms aren't feeling numb or anything
My
like
hands
that.
are maybe a little. This one feels kind of funny.
Just today?
Yeah.
Or
Just today.
Okay. I'll just run through some. We'll get to a Cincinnati stroke. I'll just run through some risk factors. You haven't noticed it difficult to think or focus on anything lately? Or,
No.
Today, are you feeling that way, or are you
A
feeling
little
kind
bit,
of cloudy?
maybe
Or?
a little bit cloudy now.
Okay.
Since today, but yeah, just today.
So you're noticing you're having trouble up and around walking, but not noticing any changes in your face and being able to swallow or any
Not really,
taste
no,
or anything
no.
that you noticed. So you do have hypertension, diabetes. Are you a smoker?
Yeah.
Okay. How often do you? How many?
Maybe a pack a week.
Pack a week. Any history of cardiovascular disease other than the high cholesterol?
Just high blood pressure.
No angina,
No.
peripheral vascular disease, no chronic kidney disease, no history of atrial fibrillation or
No.
irregular heartbeat, enlarged heart, left ventricular hypertrophy.
No.
And how much would you walk a day?
Not a whole lot. I don't usually get out too much. Maybe
Like less than 5 minutes a day?
maybe around there. Yeah.
Any psychiatric conditions at all?
No.
Cardiovascular,
No.
any of the recovered respiratory problems with your
No.
lungs? No problems with your stomach or esophagus or
No.
bowels? Urinary, everything
Mhm.
normal there? And you have the diabetes, no other endocrine issues, and no musculoskeletal things. When did you last see your doctor?
A couple months ago, we're trying to just look at my sugars.
Okay, what's your when was the last time you ate?
I had lunch this afternoon.
Okay, partner, we got our vital signs back, so we'll get our full list of vital signs back. I'm just going to do a Cincinnati stroke scale with you, if that's okay. We're going to get you to, first thing, you're just going to stick your hands up in the air and close your eyes. So both palms up, please. Close your eyes. And so we see some movement that's not appropriate there, so put your hands down. Can you give me a really big smile? Big smile. And we see some asymmetry there in your face. And you say the words, "Can't teach an old dog new tricks." And we'll say that you don't have any speech, or we probably would have noticed that.
Can't teach an old dog new tricks.
So we've got a little bit of facial droop that I'm noticing, and a weakness. Because we're seeing that right now, we're going to get on the road to the hospital just in case some of those symptoms can be associated with a stroke, which is a time-sensitive disease. So we've got your allergies and medications and your vital signs, and we're going to get on the road and into the back of the ambulance. So we'll get into the back of the ambulance. I'm just going to work through a couple of questions here with you that they're going to want to know our stroke reperfusion checklist. And then after that, we will notify the stroke center, depending on how far away, and we'll notify them that we're coming. And we'll get a couple of large bore, we'll get IVs, 2 IVs would be lovely. So we'll say those things are done and we're in the truck. We'll have you swing around in feet and we'll say you're buckled in. When I would have had the patient when they stood, as far as gait assessment, we'll see how they stand up. If he could stand when he was coming from the stretcher over here, if he could stand up without assistance, then we try, we just see what his gait is like. Most likely he'll probably be unsteady with these findings. So we'll say that he needed a little assistance over. So if he had needed any assistance standing, we wouldn't continue with any further gait assessment. So now we're just going to do a quick physical assessment, and then we'll dig in a little bit more to your cranial nerves and other things. Now that we're en route to hospital, get you do a little physical assessment on you, if that's okay.
Sounds good.
Let me have a look at your eyes here for a second. Just look right at my nose here. I'm just going to shine a light in your eyes. Okay. Great. Okay, can you, so we're just going to get you to turn your head to the side there. Good. The other side, great. Open your eyes, stick out your tongue. Looks nice and moist. Do you mind if I'm just going to feel the arteries here in your neck, okay? I'm just going to listen to them as well, if that's all right. Okay, I don't hear anything there. Looking at any scars, rashes, and lesions of face, neck, chest, abdomen. None seen, normal AP diameter. No evidence of any accessory muscle use. I'm just going to listen to your lungs. You don't have any pain in your chest at all. I'm just going to listen to your lungs, okay? So take a nice deep breath for me. And out. And good. And good. Good. Again. And again. Yeah, and in and out through your mouth if you would. Good. And once more. Good. And you can just breathe normal through your nose, and I'm just going to listen to your heart, okay? And obviously I'd be listening directly on his chest, not through his shirt. Any pain in your belly?
Nope.
No? Okay. No incontinence. Just going to come down and look at your legs. Good color and movement. We're going to do some. So we're just going to walk through a quick cranial nerve assessment while on our way to the hospital with you. Can you close your eyes really tight? Okay, open your face wide, 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 wide. Open eyes, lift your eyebrows. Open your mouth. Great. Can you, I'm just going to get you to look here for a second. Look at my light here. I'm going to shine the light in your eyes here just for a second. Look right at my nose, sorry. Back over here. Great. Okay, now just follow my lights. We're just going to go back and forth, and up and down. Good. Are you noticing any vision changes at all that you're seeing? Okay, how many fingers am I holding up?
4.
Okay, what about now? 2. Okay, great. Noticing any difference in your, are you able to, in your smell? Have you noticed anything? That's an alcohol swab. You can have a smell that.
Yeah, it smells like an alcohol swab.
Smell that. Can you, first here, try to puff your cheeks out. Great, and having trouble with that. And we've got a smile. Just gonna check your hearing and see if there's any difference here. Can you hear this?
Yep.
What about this side?
Yep.
Okay, which side am I rubbing?
Both.
Okay, great. And we're just gonna work down and, can you swallow for me? You try to swallow, does that feel okay?
Yep.
No differences there. We're done. Cool. I'm just gonna go through sensory right now. So we're just going to check how things, we're going to do a quick sensory assessment on you. I just have a couple of things here, something sharp and something else. We'll start off on your face here. Does this feel fine here and here?
Yep.
Any difference?
Nope.
Here and here?
Nope.
Any difference here or here?
Nope.
Great. What about your arms here? Does that feel the same with the same side on both sides?
Yep.
What about down in your ankles?
Mm-hmm.
Does that feel the same on both sides?
Yep.
Okay. Just something sharp. Does that feel the same here and here?
Yep.
And here and here?
Yep.
What about here and here?
Yep.
Great. On your arms,
Mm-hmm.
both sides feel the same? Bit the same? Bit the same? Great.
Mm-hmm.
A little just on your hands here. Do you feel this on your finger?
Yep.
Does it feel a vibration, a little buzz?
Yep.
And we just feel on your ankles. Does that feel the same
Yep.
there and there?
Absolutely.
Great. I'm just going to go through some muscle strength with you. You squeeze my hands again for me. Okay, make 2 fists. You can punch me. Okay, push me away. Push, push, push. Pull me towards you. Great. You shrug your shoulders. Okay. We're just going to have you push down on your feet. Push, 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 push. Pull, pull down. Be really strong. Pull, 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 pull. You can lift your legs up for a second. Just bring your knees up. Bring your knees up. Push my hands down to the bed. Push, 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 push. Pull your knees up. Great. Squish my hands together. Great. Just a couple of things for coordination. Can I get you to just tap one hand together? Tap, 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 tap. Other side. Tap, 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 tap. Can you touch your nose and then touch my finger? Okay, back and forth, back and forth. Other one, please. Great. Okay, can I get you to take your heel and just touch it to your knee and run it down your shin? And the other side. Great. Check your reflexes. Can you just put your arms down nice and loose? And I want you just to see there. I want you to count the lights on the ceiling if you would, okay? Just gonna see. Okay, great. Okay. Oh, just like you count the lights. How many lights?
6. Odd.
Good. Okay, how many cabinets do I have on the wall there?
2, 4, 6, 8.
Right. Good. I have some questions for you that we're just going to run over, just around your thinking. How old are you?
68. I think I said it wasn't scenario.
68. Do you know what day it is today? What's the date?
Today is May 2nd.
Okay, yeah, I know. You're bang on with May 2nd as I'm looking at my watch. That's not fair. And where are you right now?
At Holland College.
Okay. So can you tell me something that's been going on in the news lately?
Russian attacks.
Okay. Who's our Prime Minister?
Justin Trudeau.
Okay, what's 20 times 3?
60.
60. Can you touch your left ear and then your right shoulder? Good. What does these things have in common? Apple, pear, peach,
Fruit.
bed, table, chair.
Furniture.
What's the proverb mean? Don't put all your eggs in one basket.
Don't put all your things. Don't put everything on one thing.
Can you say no ifs, ands, or buts for me?
No ifs, ands, or buts.
Okay. I just have some pictures here that I want you to look at. Can you tell me what's going on in this picture right here?
A woman's washing dishes and a kid's getting into the candy. The two cookie jars.
Okay, and what's this?
It's a glove.
Okay.
It's a key.
Yep.
It's a chair. Cactus. Hammock. Feather.
Okay. Can you say? Can you read this to me right here?
The whole thing?
Yep.
Yeah. You know how, down to earth, I got home from work, near the table in the dining room. They heard him speak on the radio last night.
Okay, can you repeat after me? Mama.
Mama.
Tip top.
Tip top.
50-50.
50-50.
Thanks.
Thanks.
Huckleberry.
Huckleberry.
Baseball player.
Baseball player.
So now we'll go ahead and work through and be able to calculate our NIH score as we're transporting this patient. I'd like to emphasize this patient needs to be stable. We need to be prioritizing getting the patient to the stroke center. So we came in, we did level conscious ABC, we went through OPQRST and then ample. Then we did a Cincinnati stroke scale, found him to be positive. We get on the truck and we get an IV. We do our thrombolytic checklist and we notify the stroke center. And if we're close, we might not get that patient any further than that if we're close to the hospital. If you're further out, then we did a regional physical assessment and then got into a specific neurological assessment, which included his cranial nerve function, motor, sensory, reflexes, coordination, and cognition. And then we can do an NIH score for where he is currently. But I want to emphasize this would be in a patient that we're already treating or heading towards treatment for a stroke, and then we're able to document a little bit better where their neurological findings are. And the reason is the neurologist and the one making the decision about thrombolytics or other treatments is going to want to know a clear baseline of where the patient was, and then they can use that information to decide what the appropriate treatment is for this patient.
Cool. All right. I will get to the neuro one tonight. I'll try and do some of the other ones tonight.
No.